It's okay.
It's her birthday today. No, Nancy's birthday. She's 26.
I want to find a way to get down. If I'm in the neighborhood, I'm stopping.
Good morning, ladies and gentlemen, and welcome to the October 7th, 2021 State Board of Education meeting. I'm Eric Davis, Chair of the Board, and I call this meeting to order. Delighted to welcome all board members, advisors, staff, on-site visitors, online listeners, and Twitter followers. And remind you that you're able to follow the North Carolina State Board of Education on Twitter at @StateBoard_NC. And you can also view all of our meeting materials and follow the meeting online. Yesterday, we had an opportunity to express our gratitude to our principals as part of Principal Appreciation Month. You know, besides teachers and parents, two other groups that certainly know the contributions that our principals are delivering each day are our superintendents and our local boards of education. And so at this time, I'm delighted to call on our advisors, Brenda Stevens and Brent Williams, to share their thoughts on the contributions that our principals make to our students each day. Stevens.
Thank you. So each October, National Principals Month recognizes the essential role that principals play in making a school great. Principals are among the hardest working, yet often least recognized individuals in education. So, thank you, Chair Davis, for carving out time for us to take this opportunity to acknowledge our amazing principals. They set the academic tone for their schools, and it is their vision, determination, dedication that provide the mobilizing force for achieving student success. So, on behalf of school board members, we honor our principals for their tireless efforts in pursuit of excellence in education. Thank you again.
Thank you, Ms. Stevens.
Thank you. In this time of pandemic and recovery, with so much that is still uneasy and somewhat unknown, some things remain absolutely certain. Our outstanding principals, like so many other wonderful educators in our schools, step forward every day to lead the way with courage and a heart for what is best for the students and staff members that we all are so richly blessed to serve. These outstanding school administrators are responsible for what on any given day can seem like everything in the world on a school campus. When the pandemic hit, they not only adapted to the different, the unfamiliar, and the often just plain uncomfortable requirements created by the COVID-19 response, but also they created new and innovative pathways of leading and lighting the way. Their hard work and compassionate leadership helped our schools to reopen safely and to move forward in service to our young people. With so much remaining pandemic-related anxiety and points of potential disagreement in our communities, across our state and across our nation, let us be resolved as educators, as parents, as citizens of our nation to lift up in admiration and appreciation these special leaders, our principals, for the inspiring and powerful example of true excellence in leadership that they set forth on our school campuses every day. Today and every day, this month and every month, let us recognize these uplifting and inspiring beacons of consistent hope, reassurance, and determination during this season of pandemic in what otherwise could have been a time of more darkness and despair than the pure joy of childhood. Let us thank our principals, our principal or head teachers, our drivers of change, our bold, fearless educational warriors for what is right and best for children, our real-life superheroes, who truly do change the world for the better every day by reaching and teaching, by leading and loving, and by showing all the true power of what selfless servant leadership really can accomplish. On behalf of North Carolina superintendents and the North Carolina School Superintendents Association, congratulations to our principals. Mr. Chairman, thank you.
Thank you both, Ms. Stevens and Dr. Williams, for those remarks, and I can't help but particularly thank our Ms. Clemens and Ms. Ashburn for your roles as our principal advisors. Thank you. Well, in addition, this month includes National Braille Week, which is October 11th through the 19th, and it's a time to raise awareness of the needs of our visually impaired students and the importance of Braille and other alternative formats that open the written word to people with vision impairment. National Braille Week runs the second week of October, coinciding with World Saint Day. And in honor of National Braille Week, I extend a special thanks to those serving in our residential schools and all other professionals who prepare students with visual impairments for success in school and beyond. A growing population in our state are our Hispanic students, and as we continue to develop policies and practices for each and every student group, we would be remiss for not mentioning Hispanic Heritage Month, which started September 15th and concludes October 15th. We'll continue to build inclusive and culturally relevant resources and materials to celebrate each and every group in our public schools. At this time, would you please join me in the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're going to make a slight change to our agenda and move to our partners with the Department of Health and Human Services. And as we bring them forward, I'd remind us that COVID-19 continues to live with us, and with many variations of the virus mutating, requiring us to protect ourselves and our fellow neighbors. Over the last month, we've lost a public school student and many public school leaders, teachers, and staff. Far too many of our precious students and educators. We grieve with the families and school communities, and we continue to elevate the need to follow the science and participate in those mitigating measures such as vaccines, masking, and distancing to help to keep everyone safe and to keep our students in our schools. This requires each and every one of us to do our part, and we all have a responsibility to continue to do whatever we can to keep ourselves, our students, and our communities safe. At this time, we'll hear from our partners at the Department of Health and Human Services with an update on the Strong Schools Toolkit, school immunizations, and other developments. This time I'll call on Dr. Tilson.
Thank you very much. And unfortunately, Chief Deputy Secretary Gail Perry couldn't be with us this morning. She is actually at a child care setting. North Carolina was fortunate enough to get a lot of support and grants for our early childhood and child care settings. So she is supporting that. So you'll have to be okay just with me. But I really appreciate this partnership and appreciate the opportunity to be with you all. We actually have a fair amount of updates and information that I wanted to share with you. So we will dive right in for that. Wonderful. I'm going to give a little bit of an update on our COVID-19 trends, especially as it relates to our children, about some of our vaccine trends, and then some of the recent toolkit changes that we have done. And actually, we are not going to go over some of the testing program updates just because we had so much to share this morning. I'll just very briefly say that we've had great uptake of our schools' involvement in the testing program, especially amongst our public schools. So we're very excited about that, and we're happy to share data or updates on that at the next meeting. Wonderful. A little bit of an update of our trends. As we've always done, we follow 4 key metrics because one metric alone does not really give the full picture. So we look at the number of daily lab confirmed cases. We look at the % of all tests that are positive. We look at the number of people that are hospitalized, and we look at our emergency department visits for for COVID-like illness. This slide actually does not look like it has the most updated trends. I'm not sure why there was a disconnect. So I will verbally talk about our trends because this is a little bit of updated. All 4 of our trends now are declining, which is very, very good. We had some leveling off, and now we're actually seeing declining in all 4 of our metrics, which is good news. And while our metrics are declining, we do, I think it is still very important to iterate that we still have a high level of viral spread across the state. Overall, North Carolina is still 2.5 times above the threshold for a high level of community transmission as defined by CDC, and all 100 of our counties are in that categorized as high level of transmission. So the good news is our trends and our rates are coming down, but we still are not out of the woods yet. We still have very high levels of transmission. So I'm not really sure if this is Deanna. These slides do not look like their most recent slides. So I am wondering if I could do a call an audible and instead switch to my screen and just show the most updated slides, because I'm afraid the presentation that's being presented is not the updated one that we sent you on Tuesday. Could I do that and call an audible and just show my my slides?
Yes, that's fine.
Okay, thank you. Let me do that. Great. Can you see my new slides now up on my screen?
Yes.
Wonderful. Okay, great. Not sure where that disconnect was, but I'm glad we have flexibility. Wonderful. Okay, so this is looks at our case rates across all of our age groups. And what you'll see is across all of our age groups, our cases are decreasing. But the one thing I did want to point out was the yellow line, that is our case rates for our children 0 to 17. The good news is those case rates are decreasing. However, it does remain that really since the first time of the pandemic and since August, our children still have the highest case rate across all of our populations. That, again, that's the yellow line, but they are decreasing steeply, which is good news. And this drills in just a little bit more in granularity within our case rates amongst our children. What you'll see is our high schoolers are that purple line and our middle schoolers are that green line. They have had the highest case rates across our children, but they are decreasing quite steeply. And then our elementary school, the 5 to 9, is that red line, and then our preschoolers 0 to 4 are that yellow line. They've had the lowest case rate amongst our age group. So good news is across all of our kids, that case rate is decreasing, but we do still see higher case rates amongst our older children. This looks at our cluster data. The purple bars are our K-12 clusters, and you can see that still our K-12 clusters are higher than they have been throughout the pandemic. However, our clusters are also decreasing as well. So as our case rates and our clusters are decreasing. So we're really excited about that and really the incredible work that our schools are doing to minimize spread within their population. I think they're doing a great job, and we're showing the success of all of that layered prevention strategies. I also wanted to share a little bit of some data looking at some of the evidence around schools that have mask requirements and schools that don't. We've been trying to track that, so I'm going to share a little bit of North Carolina data, and then also we have data from other states as well. As we've entered this new school year, and especially with the Delta variant, and looking at the effect of mask requirements or not. So the first piece of data looks specifically at some of our cluster data, and this was a time when we had 3 counties without a mask mandate from the beginning of the school year. In those 3 counties, there was an average of 17 clusters per 100 schools in those 3 counties that did not have a mask mandate. We also looked at 89 counties that did have a mask mandate from the beginning of the school year. Amongst those 89 counties, 35 counties did not report any school clusters at all, which is really great news. And amongst the 54 counties that reported at least 1 school cluster, on average, there was about 7 clusters per 100 schools. So it was about half as many clusters per 100 schools in those counties with a consistent mask mandate as opposed to those counties without. And then there were 8 counties that had clusters and then switched some of their mask requirements, and we didn't include those in this analysis just because they had a little bit of a mid-course redirection. And this was just, I think last time I shared a case study of one of our school districts, and so just wanted to share another case study as well. This is recent data that was just shared with us 2 days ago in one of our North Carolina counties. And just to see the effect of, they had started school without they started school as mask optional, and then they changed to a mask requirement. On the left-hand side, you can see the effect that had on the number of total active cases, and then the number of total quarantined. So just wanted to share this one case study. Also wanted to share some of studies that have come out from CDC from other states. This came out from Arizona. And again, they looked at schools that had a mask requirement as opposed to those that didn't. And they found that schools without a mask requirement had 3.5 times more likely to have COVID outbreaks than schools that started the year without a mask requirement. And then a little bit more national data, just looking at pediatric cases in counties within which their school district had a mask requirement and compared to counties or school districts that did not have a mask requirement. That darker Duke blue are counties without a school mask requirement. That more Carolina blue are counties with a school requirement, and you can see that those counties without a school requirement had a consistent and statistically significant higher rate of pediatric cases than those counties with a school mask requirement. So just wanted to share some of this evolving data that we've been gathering, especially with the Delta variant. We already had very, very, very strong data last year that really showed the power and the effectiveness of prevention strategies, but really thinking about what does that look like with the Delta variant. So I wanted to just be sure I was sharing some of the updated data and studies that we have. Great, and then just a little bit where we are in North Carolina. Still, about 93% of students enrolled in a public district are covered by a district that has a mask requirement. We have had a few more counties recently that have switched from mask requirement to mask optional. So now we have 5 counties that are mask optional. We actually have 1 county that will be switching from a partial to a full mask requirement. That's Avery up there. And so just showing the landscape of where we are in North Carolina. A little bit of where we are with vaccination as well and what's on the horizon for children and then also for our school staff. We are doing pretty well in North Carolina. Almost 60% of our whole population has had at least 1 dose. And of course, that also includes our people 0 to 11 that are not yet eligible for a vaccine. Amongst those who are eligible for a vaccine are 12 and up. 67% of that population, and our adults, 69% have had at least 1 dose. So we're making progress. On the right-hand side, you can see the older you are, the more likely you are to get a vaccination. And so we're still working hard on getting some of our young adults also vaccinated. On the horizon of vaccinations for our younger population, and then also for boosters. On the next slide, I'm going to talk a little bit about the Pfizer booster, which is already authorized, but I'll also talk a little bit the horizon for boosters for people who didn't get Pfizer as their initial vaccine. So first, I just want to direct your attention to that first row, the Pfizer row, and what you'll see in that 5 to 11 column, the data that Pfizer has for children 5 to 11 has been submitted to the FDA for review, and there is an FDA advisory committee meeting scheduled for October 26th to review that data. As a reminder, there's about a 4-step process that happens before people can get vaccinations. One is the FDA advisory committee reviews the data and then makes a recommendation to the FDA based on that data review. The FDA then needs to make a regulatory action. They may authorize or fully approve vaccine for a population. Then it goes to CDC. They have their advisory committee on immunization practice. They also review that data and give more clinical recommendations and recommendations for populations for whom the vaccine is recommended. And then the CDC looks at those recommendations and chooses to accept them or not. So on October 26th will be the first of those 4 steps. But what we've seen in the past is once that first meeting starts, the other meetings happen pretty quickly. And so it may be that by the beginning of November, we might be through that process, and it may be that vaccines are available for children 5 to 11, maybe as early as the beginning of November. So we're very excited about that, and we're planning for that to make sure that it is readily accessible to all those families that have been eager to have vaccine for their children. I also then, on the Moderna and Janssen rows, I want to bring you all the way over to the right-hand column under boosters. We have been notified that FDA, the same advisory committee meeting, will be reviewing data for boosters for people who received Moderna on October 14th, so that's just the end of next week. And then J&J or Janssen also next week. So they'll be reviewing that data. Again, that's the first of those 4 processes, but as early as next week. So I don't expect that, I expect recommendations and hopefully availability for boosters to be only a couple weeks away for those people who got different vaccines than Pfizer as their initial vaccine. But for Pfizer, for people who did get their initial vaccine for Pfizer, I hope people are aware that that is currently authorized and recommended and available. So if you received your initial 2 series from Pfizer, and it has been at least 6 months from your second Pfizer shot, then you may be eligible for a booster. And the populations for whom it is authorized and recommended is for anybody over 65 and over, and then any adult 18 and up, because that is the data that they had to look at that. They didn't review data for 16 and up or even 12 and up. So for people 18 and up, if they have another risk characteristic or risk category, they are also eligible for a booster. So that includes anybody that lives or works in a nursing home or long-term care facility, anybody with an underlying medical condition as described by the CDC that puts them at a higher risk of severe illness. So this includes obesity, asthma, heart disease, high blood pressure. Anybody with an underlying high-risk medical condition, adults, are eligible for a Pfizer booster. And if they work in a high-risk profession, they're a frontline essential worker in contact with a lot of people, high risk of exposure, they also are eligible for a booster. And this includes our school personnel, our teachers, our bus drivers, our food service staff, our custodial workers. They are included as that frontline essential worker. And then anybody who lives or works in a place where a lot of people live together, our congregate living settings, so things like homeless shelters, correction facilities, migrant farm, dormitories. Those are all people who are eligible. People can self-attest that they're in this group. They do not need proof of documentation for eligibility for boosters. So I wanted to make sure that people knew that. We've had a lot of questions. Our teachers, our school personnel eligible for boosters? They are, if they got Pfizer as their initial dose, and they're at least 6 months after their second dose of Pfizer. Another piece I wanted to call attention to, because of this enormous surge that we had with Delta, because of these high rates of case rates in our pediatric population, because of the enormous strain that we've had on our healthcare system, especially our pediatric providers, our outpatient providers. We have really had an enormous medical surge and strain on our healthcare setting. And what we were hearing more and more from many, many, many of our healthcare providers is that they could not get our students, families in for their well child visits, for their health assessment visits, and for their routine school immunizations because of the incredible strain that has been on our healthcare systems. And we were also hearing more and more from people, from healthcare providers, that they were running out of their routine vaccine supply. And what we didn't want is to have more kids excluded from school that have already been excluded from school. And so what we did, I hope that you're aware of this, but through an executive order that was able to suspend the requirement for health assessment and reporting, and through a state health director memo that was able to extend the requirement for routine school immunizations, we were able to extend the deadline for that documentation, proof of immunization, and health assessment. And so now the 30-day grace period that typically starts on the first day of school, we've extended the beginning of that grace period to start November 30th. November 1st. And so by November 30th, families need to have that documentation, but we wanted to grant a little bit more time. However, we wanted to be sure that families had gone ahead and made that appointment, gotten ready, so they were in that queue to get that assessment and those immunizations. So there is a requirement of a documentation of upcoming an appointment, but the extension of actually getting that done, we have pushed out. And again, we were getting a lot of feedback from our healthcare providers that they just couldn't get these families in because of the incredible demand they're experiencing. And then finally, just a few updates of our K-12 toolkits that we wanted to be sure that you were aware of. One, we have done a little bit of an update on the section of what we know about COVID-19 in school settings. Some of the evolving data and science that we've been seeing, especially with the Delta variant. So we did some modest updates to that, and also making sure that we're directing people to the CDC science brief of what they're learning in schools. What we also did, because of some of this recent studies and public health data, especially that I was just sharing with you, and including a study that will be published tomorrow in pediatrics that specifically looks at North Carolina data. So all of the data that our schools have been submitting in collaboration with our ABC Science Collaborative. So specifically North Carolina data from our summer school experience when we had Delta variant very much predominantly. What we found was that still those schools that had that multi-layered protection, and remember over the summer, all the schools also had mask requirements. What we found was still a very consistent low rate of spread in schools with those, with the mask requirement and the multi-layered prevention. We still saw a small amount of viral spread in those schools. In addition, what we found was the actual risk of when an adult had a community acquired infection, the chance of spreading that to others was actually lower than when a child had a community acquired infection, mostly because likely we have much higher vaccination rates in our adult population than, of course, in our child population where they don't have vaccinations. So because of this evolving public health, this as well as some of the other studies that I have shared with you, we felt comfortable to say that we had sufficient scientific and public health information to extend the exemption of quarantine to adults in a consistent mask-on-mask setting. As you may remember, we had that quarantine exception when there was a student-to-student exposure, but there was consistent masking. Those students didn't need to quarantine. Because of this evolving data, we have felt comfortable extending that to adults as well in a K-12 setting, because that is where we have that data. So that is a update that we did in the school, and what you might remember if you've seen our Strong Schools Toolkit, read it very closely. Originally, it said the first word was students. We have changed that to individuals to allow that exemption to our adults as well. And then finally, not in our Strong Schools Toolkit because it is not a statewide change, but there is some flexibility in our public health rule that if the state approves a protocol for a epidemiological or clinical research study, then people who are enrolled in that research study can have different control measures than that is in place for the statewide control measures. And so we have approved a protocol for the ABC Science Collaborative to do a research study under their NIH research framework to do a test and stay alternative to quarantine for those students and adults who have either maybe had an unmasked exposure or another exposure that wouldn't qualify them as a quarantine exemption in districts with mask mandates. So for example, you're a district with a mask mandate, but there may be an unmasked exposure for school. For lunch, or for sports activities, or for extracurriculars. We have approved a protocol, and the ABC Science Collaborative will be doing a research study in a select of our districts that they're working really closely within in order to pilot test this test and stay quarantine. And then based on that data, we can think about what might be phase 2 or being able to extend it to think about testing it in higher risk settings. But right now we have approved a protocol to test that in the lower risk settings. And again, those lower risk settings are those districts that have that mask mandate. So ABC Collaborative will be identifying those districts and working with them closely as we move forward. And another material that we linked to our Strong Schools Toolkit, and we wanted to make sure you're aware of, but there has been a fair amount of conversation and need for clarification specifically on legal requirements, legal authorities when it comes to isolation, quarantine, exclusion, what are the roles and responsibilities of schools and health directors. And so we have 2 new documents that we have posted that really goes more deeply into control measures, isolation, quarantine, exclusion, and specifically legal requirements. So wanted to be sure that you're aware of that. We have linked it in our Strong Schools Toolkit. We also have that posted on our website in our Strong Schools section. So wanted to be sure people knew of that resource because there has been a desire for clarity on these issues. So we wanted to be able to share that clarity. Okay, and that is it for me. I know that was a fair amount of information, but there has been a lot of changes, so I wanted to be sure I shared that. I will stop sharing my screen and happy to take some questions.
Thank you, Dr. Tilson. We appreciate the updated report and the continued progress we're making in combating COVID-19 in the partnership with DHHS. To my colleagues, I'll remind you that it has been our custom each month as updates are made to the Strong Schools Toolkit that the board adopt the most recent version. And so as part of our action agenda today, the following motion will be before us for consideration: that the State Board of Education approve as official guidance for the safe delivery of instruction in our public schools for the 2021-2022 academic year, the Strong Schools NC Public Health Toolkit K through 12, issued by the North Carolina Department of Health and Human Services with amendments as of October 5th, 2021. Are there any questions or comments from my colleagues for Dr. Tilson? Ms. White.
Thank you, Chair Davis. Dr. Tilson, I know that you're aware that there is an ongoing debate about the use of masks in school, and I was very interested in the data that you presented today about the caseloads in the counties that have mandates in place versus the counties that do not. More interesting to me, could you provide or answer the question, do you have the comparative data available for us on hospitalization and death rate in the 0 to 17 demographic that would represent students that are in our schools? The most pointed question would be, is there a difference in the number of children, students in our public schools that are hospitalized in the comparison between those counties, and is there a difference in the death rate?
Thank you for that question. It is a little bit hard to, so my first answer is no, I don't have that specific data for you. I can certainly go back to our EPI team to see if we can get that data for you. I'm happy to try to share that. The couple limitations are going to be on that is, thankfully, as we've talked about, the death rate for children is low, thankfully. So we are going to have a very low number, so that probably won't be a very reliable data point. And so we could think about, whether or not there is more national data or working with CDC, and if we can get more school districts and look at that with a bigger N, because thankfully with a small number of child deaths, that probably wouldn't be a very stable or reliable data point. For hospitalizations, again, it's still relatively low rate of hospitalizations amongst our children, thankfully. So that might be a relatively unstable data point with just North Carolina as well. But we could look at that. What we do often look at is our hospitalization rates in our Region 4, which is our southeast region, and looking at our pediatric hospitalization trends, because then we get a little bit of a larger number and it's a little bit more of a stable rate. So we could see if there's anything on that regional level. But right now, I don't have death or hospitalization rate based on mask mandates. And the other thing to remember, too, is that we only had 3 counties that didn't have a mask mandate. And so we don't, that is a small N as well. So I understand your point. We may not have robust enough and reliable data to get you the answer you're trying to answer, but I can look at what we have that might give a little bit more clarity on that.
If you could, as a follow, I would really appreciate that. Following COVID
tell you
over
where we could look, but we just don't think the data is reliable enough to report out. So we can look both ways.
That would be most helpful. Again, I think that, as I've said many times as I've asked questions, I'm not a scientist, but at the same point, there are many cases, as you have said many times, that are asymptomatic, and so counting cases can inflate and incite action. Sometimes that's not necessary, so I think it's important for us to really look at impact. There are many flu cases during the state each year, but that number has dissipated. And so for us to really get an accurate picture on the impact of COVID on our students and our schools, I think it's important for us to find out whether or not those cases are reflected in hospitalizations and whether those cases are reflected in an increased death rate. And that might help our decision makers make better decisions.
Yep, appreciate that. And the one other thing that would contribute, remember, is that there's also, and one of the revisions, that children are pretty efficient spreaders as well. And so thinking about then spreading to adults or people with higher risk for severity as well. So having to think about that, taking into consideration the spread to adults and the hospitalizations and death of adults as part of that transmission. So they're all, it's all connected ecosystem, and we have to remember our kids are just part of that connected ecosystem. But I understand your point, and we can see if we can get any data that is reliable enough on that point.
Any other comments or questions? Hearing none, Dr. Tilson, thank you again. Please express our gratitude to Chief Deputy Secretary Gail Perry and Secretary Cohen and the entire DHHS team for the partnership in keeping our communities and students safe.
Great, thank you. Appreciate it very much.
Thank you. And as a follow-up to the DHS presentation, I'd now like to call on our General Counsel to provide a brief presentation on COVID-19 responsibilities for local boards of education. Ms. Schaefer.
Good morning, members of the board, superintendent, and members of the audience. I was asked to summarize for the board and the community and the public out there and the schools what the school's requirements are with regard to cooperating with the health department, local health departments, and DHHS in terms of the COVID-19 outbreak. So before you is the document that Dr. Tilson referred to, and it's online and available. It was updated October 5, which was earlier this week, to be clear about what schools are required to do under the law. And so I just wanted to summarize that and answer any questions you might have. First of all, the document talks about 2 different kinds of measures that schools either must or may take. The first is control measures, and those are measures that are designed to address known or suspected cases of outbreaks of COVID-19 or other communicable diseases, and those would include quarantine, isolation, contact tracing, and exclusion from school. Those are mandatory, and we'll talk about those in a minute. The other category are preventive measures that would include masks or vaccinations or social distancing that are designed to try to keep the spread going from happening at all. So there's been a lot of confusion in the schools about what the legal requirements are. First of all, Under the law, schools are required to work with local health departments to identify, contact trace, and exclude children who may have contracted the disease or are suspected of contracting the disease, and also to identify those who have been exposed. School principals are required by law to report to the local health department anyone who they are aware has been diagnosed with COVID-19 or other communicable diseases, and these laws have been in place for a while, so it applies to all identified communicable diseases, or people that they believe have been exposed to COVID-19. So if a student or staff member tests positive and that information comes to the attention of the school principal, it must be shared with the local health department. Once notified, the local health director is required to investigate, and that includes contact tracing, which is finding out who may have been exposed and what to do about it. Health directors are entitled to ask for information from the schools that may be confidential otherwise. They are required to turn over student records or information about who may have been in a classroom that would allow the local health director to identify both who is ill and or who has been exposed. Schools are the only ones that are in possession of a lot of that information, so the cooperation and the working relationship is important, and there needs to be a constant dialogue about these issues between the local schools, whether they're charter schools or public schools, and records must be promptly released so that if there is an outbreak, it can be stemmed to the extent possible. So contact tracing is just a part of the investigation the health director does. Once it is determined who has been exposed, then the local health department has to they have to identify control measures, but generally the ones that are used are isolating. Isolation is the term referred to isolating children who have the disease, and quarantine is referred to quarantine children away from others or staff who have been exposed to the disease. So schools don't issue those orders. They don't have the authority to issue those orders, but they are required to exclude people from school. So exclusion is another control measure. Exclude people from school who are either subject to quarantine or for isolation. It is not required that there be an order in place from the health department that someone be isolated or quarantined. All people are required to cooperate with these measures and to exclude them, or to isolate or quarantine themselves if they're aware that they have COVID or have been exposed. If they fail to do that, the health department can issue an order, but it's not going to happen in every case. The individuals against whom the quarantine or isolation rules apply have a duty to comply with them anyway. And then schools, again, to the extent that they are aware of the rules, even if there's not an official quarantine or isolation order, have to exclude people that they're aware of that meet the criteria for either exclusion or contact tracing. Exclusion from school, generally, the guidance says that 14 days is the time that it takes to see whether someone actually comes down with a case of COVID-19. However, the guidance and the toolkit go through ways that can either be reduced or eliminated depending on whether masks are worn, depending on whether there are symptoms present. Generally, someone with the disease has to wait until they are no longer exhibiting symptoms and are able to pass the disease on. And again, quarantine orders depend on the control measures in place, the symptoms that are being shown, and those need to be resolved at the local level. Again, the health department directives and these control measures are mandatory for schools. The measures like masks, there are different rules. The preventive measures, masks are optional or can be optional with the school district. We are aware of that, and that those policies have to be in place for every school district or every school, and they are supposed to be voted on at every monthly meeting. But again, there's a difference between the mandatory and the preventive. I will say one thing though, there is a federal CDC order that on school buses, masks have to be worn regardless of whether there's a mask mandate in the school district or not, or for the school. So that is a federal order, and it's for all public transportation, which includes school buses. That's a brief summary of what's in the guidance. I will welcome any questions or if you need any further information or clarification.
Thank you, Ms. Schaefer. Appreciate that report and add clarity to our responsibilities and those of our local districts. Ms. Clemens.
Hey, good morning.
Good morning.
Good morning. I have just a quick question, and you said this multiple times, so I'm just going to give a little bit of scenario and help me think through this. So as, a principal, if it is Saturday morning and I receive a message from a parent that their child has tested positive for COVID, and I know that that this child, during lunch, where they don't have masks, have been sitting around these 3 students. Our school nurses, who is a part of our local health department, don't work on the weekends. So are you saying it's, as far as the principal has the authority before contact tracing and all of that to notify
The duty is to notify the local health department, so I
Okay.
would definitely do that on the weekend and get guidance from them about what they expect of you. They may well want to get information about who may have been exposed, so those students can be excluded before Monday morning comes around. So I would work with the local health department and develop a plan for how those things would be followed through.
Okay. I think that's where I was getting at. You said specifically about the exclusion. So we notify someone at the health department, but, if it's not happening until that Monday or Tuesday
morning.
when they're coming back.
If you know someone has COVID, that person should be excluded from the school as of Monday morning. Who has been in touch with them would need to be identified and determine whether or not they would be subject to quarantine.
Okay.
And that you would have to work with the health department.
Okay. And that wouldn't happen until they return?
Unless the health department wants you to do it sooner.
Okay.
If they say you need to do this over the weekend, I would do it over the weekend. So
Okay.
it really depends on what their guidance is.
Okay, thank you.
Just work with them, yeah. Anything else?
Thank you, Ms. Clemens. Other questions?
Thank you.
Thank you, Ms. Schaefer. I now turn to Superintendent Truitt for the superintendent's report.
Thank you, Chair Davis. Good morning to everyone. It's wonderful to be here with you again for day 2 of our October State Board meeting. I had tonsillitis and had lost my voice last month, so you're going to get a twofer this month. Excuse me. So I've got a couple of things to talk with you about this morning, but I want to start by highlighting that Operation Polaris is live now on DPI's website. We had an official unveiling a couple of weeks ago since the last state board meeting. And we're really excited that, if you could go to the next slide, please, that it is, the way I look at Operation Polaris is that we needed to have a plan for pandemic recovery to address the unfinished learning that our students have experienced, but not at the expense of a forward-thinking, bold vision for addressing and hopefully rectifying some of our long-standing challenges in education in North Carolina. And so Operation Polaris addresses everything from how we might compensate teachers to how we want to support districts with expending their federal funds from COVID relief. And I think it's important to note that it is not a document that is set in stone. It is meant to be dynamic, to be refined over time. There are a lot of collaborative partners that are part of Operation Polaris. This is not just a DPI document. And so as we continue to meet regularly with our Operation Polaris work groups, we are going to find ways to involve the board in that work and provide updates as well. Okay, moving forward. So back back in 2016, when I was in the governor's office, I had the opportunity to be a part of an initiative funded by the National Governors Association. And that initiative was to look at workforce development in North Carolina in terms of education and to do some predicting about what our education and workforce needs were going to be in the future. And at that time, North Carolina's economy, of course this was way before the pandemic, was continuing to grow post-recession. And the Lumina Foundation data that was provided to North Carolina at that time said that by 2024, if we continued with the if we continued as we had been in terms of those with post-secondary training and education, that we would not meet our workforce demand. And so that work ended up going to the UNC system, and President Spellings was very much the leader of our what has eventually become My Future NC, which, as we all know, is a goal of 2 million more people with training and education beyond high school by the year 2030. And so this first graph right here, this graphic, has been updated, but the first time I saw it was back in 2016 when at this group I was part of with the National Governors Association contracted with Carolina Demography, who has continued to do the work for My Future NC. And what it shows is that only 31% of our students each year earn a degree or credential within 6 years of graduating from high school. And what I also learned during that time, which has really stuck with me, is the percentage of children who graduate from high school, begin a 2-year or 4-year degree, but don't persist. In other words, they don't make it to the second year. It's hard to get solid data on the number that don't make it to the second semester even. But we know from other data that we've got kids who are accepted to a post-secondary institution, including our 4-year colleges, who don't even make it the first day because of so many barriers. And so what I also recall about this 31% degree is that it's actually about 28%, as I recall, don't earn only 28% earn a 4-year degree within 6 years of graduating from high school, and only 15% do so at a UNC system school. So the rest are going private or out of state. To that end, we need to be asking ourselves this question: is it enough that a student simply graduates with a high school diploma? And the answer is obviously no. We need to not just be focused on the number of students who are graduating, but what happens to our students after they leave our public high schools? Are they able to be successful in the post-secondary plans of their choice? And it's for this reason that I created the Special Advisor on Workforce Engagement, and you've seen Christy Van Auken present to you last month. The Education to Workforce Continuum is a priority of this board in its goal of eliminating opportunity gaps. It is also part of Operation Polaris and is one of our key focal points when we do district visits and voices. So our joint goals are to increase readiness, access, and attainment of post-secondary opportunities in high school. We need to, once and for all, bridge the disconnect between a student's high school experience and what it is they're passionate about and what they want to do after high school, to connect them to some kind of a pathway that represents what they want to do. So I have some recent data here from the North Carolina Education Development Partnership, Economic Development Partnership from Chris Chung. In North Carolina, we've had about $5.2 billion in business investment expansion over the past 12 months. 12,000 new jobs created, rapid pandemic recovery in most sectors. And what Chris will say is that when our economy expands in North Carolina, when businesses decide to come to North Carolina, it's because they can find the workforce that they need. So obviously we need to continue for our K-12 system to be aligned with our community colleges and our four-year institutions such that we are ensuring that all students are prepared to be a part of the workforce. So further, what's interesting is that unemployment is still high versus 2019, but there are thousands of job openings throughout the state. And so we've got this great post-pandemic recovery happening, and yet unemployment is still what it is. And that, what economists say, is that is due to this mismatch. So we've got a lot of leisure and hospitality jobs. Trey Michaels talked to you all about that yesterday. Manufacturing, childcare, home health care. New collar jobs in tech, financial services, biotech, and pharma. And then we still have this urban versus rural challenge because so many jobs are being added predominantly in our urban areas. And so I want to take a minute to highlight, and I'm going to share some exemplars in a minute, that we do have a duty to ensure that what we as an agency are doing is aligned, that we're helping our high schools align to workforce demand. And this is a huge equity issue, and I'll give you an example. We have a high school in the Triangle that offers something like 12 post-secondary credentials for students. And about a third of those are IT credentials that are industry recognized credentials, that someone could get a job with these credentials, an entry-level IT job. We've got rural districts that not only are they not able to offer those IT credentials, but they're still offering first aid as a credential, which is not a career path. First aid is not part of a career path. And so we need to support our districts in ensuring that what they're doing is aligned to the workforce needs in our state and is part of a viable career path. For example, if we go to the next page, there's our own Dr. Michael Marr right there. You can see his nice pate right there in the front of the picture. Visiting a summer school experience in Halifax County. And you'll remember yesterday that Trey Michaels talked to you about the solar certificates, the solar panel installation certificates. So 20 students in Halifax County were able to earn a combined 80 industry recognized stackable credentials, which means stackable meaning they will stack into other things as well. And these kids were able to earn it was learn and earn. They can earn $15 an hour while they're participating in the camp. There's articulation agreements with Halifax County and NCA&T. And then, if you go to the next slide, they were able to earn a living wage upon finishing that camp if they did not want to go on to community college. And you can see here that this is a multi-sector collaboration between the schools, the Center for Energy Education, the governor's office, Halifax Community College, NCA&T, Strata Solar is now one of their long-term partners. And the team was able to go back to Halifax County for the graduation, and it was a really special experience. Next, we had the opportunity in August to go to Wayne County schools. This is an incredibly exciting opportunity that would be the first of its kind in the country. So, of course, Seymour Johnson Air Force Base is located in Wayne County. And the Air Force Base and Wayne County Public Schools are right now in the process of creating a partnership that would put a 612 STEM-focused technical school on the base, on the installation. They would focus on AP curriculum as well as Minecraft coding credentials. And it would definitely be a STEM school that would have 50% local population and 50% student lottery for the children of service members. Excuse me. This is what we saw, that the partnership between Wayne County Schools and the leadership on the base was not like anything I've ever seen before. It was really, really incredible. And they are hoping that this first public school located on a U.S. military base could be a promising practice for other locations throughout the nation. And again, this would be portable credentials and credits that students can stack into something else after high school. And I want to give a shout out that the picture in the bottom right hand corner is the team in front of an F-15. And the wing commander is behind us. As we were there, Seymour Johnson Air Force Base planes were providing coverage in Afghanistan during the base, the rescue there. So the District and Visits Voices team, we are always very careful to ask, now what? Because it's not enough that we go on these visits and highlight all of the good work that's going on. What needs to happen now in order to ensure that this work continues and is meaningful for our students? So we will be establishing the certified CTE Solar Clean Energy Pathway. We'll continue to work with districts to ensure that these partnerships and programs are sustained. We will be able to help support this new model for public school on a military base and help replicate and scale both models. And on to the October update, which I will keep short. Speaking of workforce development, we wanted to highlight for you something that we did earlier in September. Back right after I got elected, I got an email from a young man who is in the College of Education at App State, who grew up in Surrey County, and asking me if I would come and speak with their teacher education club. And they were not even on campus at that time, and so we decided to wait until students would be back on campus, and we thought, okay, we'll do it in September because surely kids will be back on campus, and they were, and it ended up being absolutely blew me away, 100% student organized and led town hall, not just with students but also with faculty. It was just an incredible turnout. Julie and Freebird in their respective roles joined me on stage, and the students had incredible questions, and we really enjoyed. I think all of the students that we met, except for maybe 2, were from North Carolina, were really loving their educator prep program. The dean came to the event. It was just a really positive experience. And then finally, INCACTI had their virtual fall forum. I just cannot tell you how solid the relationship is between the department and INCACTI. This is crucial as we continue to ask our colleges of education sometimes to do things differently in order to better meet the needs of students so that they can better meet the needs of their future students. And so I was able to talk about Operation Polaris, what we're doing with literacy and with human capital, which are 2 things that have a direct impact on our educator prep programs. So as we continue to focus on the human capital priority of Operation Polaris around teacher recruitment and retention, we are, my team is being very intentional about engaging with all of our educator prep programs, public and private, through INCACTI and district visits. We can work to include our educator prep folks on our district visits so that they can also have opportunities to be out in the field with us. Julie continues her NC Teacher Talks, which are her roundtables with teachers who are willing to share honest feedback with her about what's happening in the field, the good and the bad. And then also we will be reviving the DPI Educators Conference. It's called AIM, and it will be at the end of November. And we are really looking forward to giving teachers something that honors their professionalism and that is going to allow them opportunities to not just hear about what's going on, but to engage with one another in a setting that is away from their district. And then, of course, our promising practices work in the Office of Learning and Recovery, which is led by Angie Molinex. We will continue to provide you updates about that. And I'm happy to take any questions.
Well, thank you, Superintendent Truitt. You certainly make a compelling argument that among the many choices we have in our state for investment, public education should be the primary choice that we make. And also I'd like to congratulate you on the official unveiling of Operation Polaris. You know, this is a significant development because it demonstrates yet again our state's commitment to fulfilling the judicial mandate to provide a sound basic education for all North Carolina students. And this duty flows from Article 9 of our Constitution through 3 branches of our state government, including this board, to our state's public education strategic plan and the comprehensive remedial plan. Polaris is the response to those plans by our superintendent and DPI and details how the strategic and comprehensive remedial plans will become a reality in our classrooms. Polaris is a thoughtful, well-organized response and is clearly aligned with both the strategic and comprehensive remedial plans. For instance, Polaris is based upon the commitment to provide an effective teacher for every student in every classroom. That North Star tenet is the first element of the comprehensive remedial plan. and is a critical component of our strategic plan, emphasis on equity and access for all students. Moreover, the remaining elements of the comprehensive remedial plan, which include effective principal leadership, an equitable financial system, a reliable assessment and accountability system, school and district turnaround, and a system of early education, along with alignment of high school to post-secondary and career expectations, will be realized through Polaris's 6 working groups, which are focused on literacy, human capital, student support services, accountability, innovation through learning recovery and acceleration, and district and school transformation. The key to success of all these plans is effective, comprehensive, disciplined implementation, keeping paramount our students' best interest. Polaris is the right framework to implement our guiding principles of equity and educating the whole child by eliminating opportunity, access, and performance gaps for all students so that they can grow and learn and thrive. We look forward to frequent updates through many of the board's established committees and to acting upon the recommendations when appropriate that our superintendent and DPI will bring us. This is challenging and important work, and it deserves our full state's support in implementing this work. Glad to entertain any questions that my colleagues have for superintendent or myself. Mr. Hall.
Thank you, sir. I don't have a question as much as a statement concerning the training that you went through. Went to visit, like in Halifax with the solar panels. Anyone know down east? That's what's coming up. You can get on 13 that can come down east, and you will see land after land, farms after farms that's now turned into the solar panel. Even my family has put up a couple of family members. So that is the future. But I want to get back to the workforce development piece that you mentioned, Superintendent. Somewhere there's a gap with that piece that you're just talking about. I serve on Region Q's Workforce Development Board. I've been up there for years. And I've never heard anyone come to the board to speak about what you just spoke on. And Region Q is the one I'm a member of. And then there's the Tar River, there are others up this way. I encourage you and your members of your team to reach out to the workforce development rural boards and talk about the need for education and to changing some things that we're doing with our high school. You made a strong point concerning the health issue. It's not a pathway. It's not stackable, as you call it. But also, I don't know if you, and I'm not sure they're still in existence. I think they are. I think it's an Edgecombe. Cummins, diesel. The thing about Cummins, the diesel engines, Cummins, they had an apprenticeship with the high schools back in the day. Now, I hope that day is not too far behind me. But they were training high school students and were paying them when they finish at that day and time, $55,000 a year. And they were also getting a stipend from Cummins. Well, Cummins needed that workforce to build those engines. So I encourage you to reach out. Because those are the success stories that you're talking about. But in order for us to get there, we've got to change our thinking, how we do things, and get into this mode just like the solar panels. Some people don't like them. Some people don't like them. They say it produces cancer. It jumps off of that panel and jumps in my I'm dead serious, you know. But those are the things that I think our people need to hear more of, especially coming out of DPI. That's my concern.
No, you're absolutely right, and while I get invited all the time to speak to chambers, et cetera, it's the workforce development boards that need to hear this message, and we will go anywhere that will have us. Thank you.
Dr. Oxendine.
Thank you very much, and I applaud you for what you're doing with Operation Polaris, because it probably is going to take us far and begin to answer some of the questions that we still have questions about. When I think of workforce development and your topic today, let me tell you what comes to mind. That CTE division right here inside this building. The presentation that Mr. Michaels gave yesterday, I'm gonna tell you, I've been on this board 8 years plus a few months, and I am still in awe over everything that happens inside this building, but CTE that's where workforce development, the talk about it, the doing about it, the making it happen, we are sitting on a gold mine right here in the building. I mean, think about, and I'm gonna just later on in my report, I'll talk just a little bit more about it, but just think about the curriculum that is within that body of work. So and I'm not saying that this isn't happening, but it's just harnessing more of that and getting more mileage out of CTE, because I can imagine the way it touches the lives of middle and high school students in North Carolina. The Department of Public Instruction, our own answer to workforce development, right here in this building. Now, I want to add another point around the scarcity of jobs in our rural communities, and I live in one of those. We know that the demographics are changing. Our rural communities are drying up in terms of numbers. When that happens, schools close, there aren't jobs for teachers and educators and school secretaries and bus drivers and on and on. But this is what a real estate agent will tell you in my neck of the woods. Businesses will go where the schools are good. The schools are producing the workforce material, and students are coming out of the high schools able to read and write and think and do math, and it shows in the data, because I am telling you, the companies probably look at EOCs and EOGs and dropout reports and so on. So the answer, I guess my point is it all comes back to the education of our students, doesn't it? It really does. How well the schools are doing what they are supposed to be doing, and how well we're doing as policymakers. And there's a role for the General Assembly as well. But when we get those schools right, we will see jobs.
Ms. White.
I'll add a stackable to Dr. Oxendine's comments. So, in the nonprofit work that I do, we provide a career pathway camp for 8th and 9th grade students who are low wealth. And what I would like to challenge the department and board members is to shift our focus from high school to middle school regarding exposure to career pathways for our adults. What we are finding is that students wait too late to make the decisions to select coursework that would be appropriate for a future post-secondary experience. They don't get it together in time. They have, I would have, I should have, I could have. If we can use the existing Holland Code system, which matches individual student gifts and talents and affinities to available careers, and then demonstrate to them the coursework that's available through the North Carolina high school curriculum, that would allow them, particularly students who are underserved in our state, that there is a pathway forward to not only a living wage, but better than that. Early is the key. We cannot wait for students to get into 10th grade and suddenly decide, oh my goodness, I couldn't have. Part of that career pathway camp that we provide takes students into the community to let them see different careers that are available. One of the places that we took them was an automotive repair shop. To their amazing discovery, someone that has the skill set and the learned abilities to work in the automotive industry can make 6 figures a year. And our folks don't understand that the service industry is one of those targeted areas. We must have plumbers, we must have electricians, we must have folks that are out there doing the service work. And it is a very real possibility, but getting to them early, not waiting till high school, is going to be the key.
Mr. Ford.
Thank you for the overview of Operation Polaris, and I appreciate the confidence in the framework as an execution and an alignment with the strategic plan, etc. I'm gonna double down on my constructive critique from yesterday, but I'm gonna offer an example. Okay, so when you download the document on page 5, you clearly see the diagram and you see how equity is interspersed throughout each of the elements within Operation Polaris. When you go further down onto page 26, you look at the background information. It does reference diversity, but it's quoting the Human Capital Roundtable, the work that began prior to. After that, all of the metrics, all the levers, or even the vision, when you read the vision, it states to cultivate multiple on-ramps for education professionals, build effective infrastructure, recruit, retain high-quality teachers, administrative support personnel, every student in North Carolina. I don't hear a focus on folks of color. I don't hear a focus on diversity. None of the metrics mention diversity. None of the metrics mention HBCUs, culturally responsive teaching. And this is the human capital star, okay? So I just want to double down that the spirit perhaps may be there. I don't see it in the letter. And so, and I'm open to being corrected. The issue I have is if it's not explicitly stated, right, then it'd be very possible for one to pursue this North Star without ever touching on those things. And I see individuals who are associated from HBCUs, folks who do research on teacher diversity or experts, but I don't see it articulated, and that gives me pause because we do articulate that in our strategic plan. It is articulated in the West Ed report, not just great effective teachers, but it talks about teacher diversity, and I don't see that in this document.
So I would call your attention to page 22 of the document that says that the North Carolina State Board of Education in February of 21 adopted the recommendations from the Human Capital Roundtable, quote, to help increase the quality, quantity, and diversity of teacher candidates and prepare them to be licensed, hired, supported, and retained as highly effective educators in North Carolina schools, which, as you stated, was part of SREB. This paragraph goes on to say, as such, the scope of work must be expanded. In addition, DPI must also be aligned with Pepsi and the Governor's Drive Task Force.
Yeah, so that's the exact part I referenced, right? And so I see the...
Well, that's page 22, not page 26.
Right. So I apologize. The document that I have is page 26. Further down, it does reference, on my document, it's 29, leveraging the recommendations from the Governor's Drive Task Force. Those recommendations explicitly talk about HBCUs, explicitly talk about retaining and recruiting educators of color. So it kind of drops it in there, right, amongst the milieu of other recommendations. But there's no, it's not pervasive, it's not intentional, and that's my concern. So it's so long as this is a living, non-static document, and we are inviting the board to take, I would just invite the possibility of perhaps revising or considering those constructive critiques in the spirit they're given.
Thank you.
Absolutely will.
And I would say, as commented on yesterday, as the work develops and comes forward, I think the points you're making, Mr. Ford, I'm confident will be lifted up out of the work, and appreciate the reminder and the continued focus on that. A simple example is the continued use of disaggregated data in all of our work. So I'm confident in working with the superintendent that will accomplish that.
Mr. Chair.
Okay, thank you. Mr. Keenan.
I'd like to chime in what Ms. Amy White was just talking about kids got to see it, they got to feel it, they got to have someone who helped them dream. And I just say this very quickly is that, you know, we can't expect our teachers and our principals to be the only ones who give them that dream. That's why you must understand the child doesn't necessarily belong only to that biological parent, but that child belongs to all of us as adults. And why I say that is because, let me give you a quick example. I've been a very blessed man. I've worked and God has blessed me to be very successful. But I have bought things not for me, but I bought things so that children can come to my home or ride in my car to understand that education will get you that. Not drugs, not illegal action, but education. When I go out through the school to speak, first thing a kid will know, how much money you make? What kind of car you drive? How much money you got in the bank? Typical kids. But the response to that I've done well, but you get it through education. Education is the economic freedom. And I tell them all the time. So the gist of the story I'm saying is Ms. White is right. That a lot of times, parents can't teach what they never got. Some parents don't know how to dream because they never had a dream. Some parents will never dream because their dream was suppressed for some reason or another. But we as a community must come together to take care of that child. The preachers, the deacons, the teachers, the social workers, that child belongs to all of us, and we must make a difference in their life by letting them dream and helping them dream and reach that goal. Thank you.
No more dreams deferred, as Langston Hughes said.
Yeah, I'll just add, Mr. Keenan is one very blessed North Carolinian. My children benefited from the teachers, the social workers, all the members of the public school system who helped them see their dream. So, so agree with you. Did I see another hand down among? Yes.
Yeah, this is Eugenia Floyd,
Yes, Ms. Floyd.
and I just wanted to lift up what Ms. White said as well, that exposure at an early age. I can say in some of my district visits as well, one of the things that I have been truly just fascinated and just uplifted by was seeing fifth graders look into CTE courses as well. Going into a middle school last week and seeing children have the opportunity to explore robotics and video production in one building in Carteret County. So I completely agree with you, Ms. White, that children have the right to see themselves and what they could be in their schools daily. And I definitely will say that there are many districts across this state that are making sure that that exposure is happening early on, and the creativity of my colleagues as well by using the technology of Zoom lately and having students Zoom in with authors and builders and creators. That is all incorporated in that work, and those are just a few examples of many of the thousands of educators who are really trying to make sure that that exposure happens for students everywhere. So thank you so much for lifting that up. I completely agree.
Dr. Williams.
Chairman, thank you. I would like to certainly agree with what Ms. Floyd said, but to go back to what Ms. White stated, to amplify that, and Mr. Keenan emphasized it as well. The recognition of the need, first of all, to commend our CTE programs. What they're doing is outstanding in our schools. It's truly life-changing for so many students, as many of our programs across the curricular areas are. But CTE in particular has so many unique qualities, but one among them is reaching out in the form of partnerships with our community, with our manufacturers, and really connecting, making those partnerships. We all talk about personalized learning, but really having a plan for every student and connecting that student to the world of work or to college or what comes next. One of the things that some districts are doing, in our district in Lenore, and I'll invite the board, the team down to visit with us on that, we'd be glad to share it, is to push, as you were saying, to push many of the things typically associated with the high school experience, like job shadowing and apprenticeships and pre-apprenticeship programs, push that down to the middle school. And then in Lenore, our goal now is that by the time every student finishes fifth grade, he or she has been to at least one college campus. And to amplify what Mr. Keenan was saying, to really in a 360 wraparound services model approach mindset, to say we're going to wrap our arms around them as a school system and not let them fail as a fundamental point, but beyond that, to say we're going to give them the best that we have. We're going to expose them to everything, because what do kids say they want to be? They want to be doctor, lawyer, in our town, professional football player, basketball player. We've had many of those, because that's what they know. But so we want to expand their scope of understanding. So we push the awareness down to elementary school, and then beyond that, we start those pre-apprenticeship and apprenticeship programs, hoping to start that in middle school. And then by the time every kid enters high school, they have an actual plan. And plus, it's a conversation for a different time, but I also would like to share with you, we have innovative programs with our Manufacturers Association, guaranteeing kids in writing actual, not just jobs, but careers with the career ladder with Crown Manufacturing and Spirit Aerosystems, and they're hiring our students. And we started that 3 years ago, and now the first groups of students have gone into those careers, and the manufacturers are paying for their college for 2 years, for 4 years, and even for engineering programs collaboratively with NC State University. So we're so pleased with that, and we'd like to share it, but I just wanted to add that. Thank you.
Any other comments?
Can I say something? Oh,
Ms. Clemens?
yeah.
Come back.
Well, I wanted to share a couple things, and I've sat here for a little while and didn't know if it was the appropriate thing to share, but I'm just going to share it anyway. So, first of all, Superintendent Truitt, I appreciate the focus and the commitment. I know that you're a teacher advocate, but the commitment to literacy instruction and science of reading and all that our teachers being provided. I do want to share, as we think about, providing our teachers the best in this great professional development, remembering that we have to create, space for those things to happen. And so as we think about the professional learning, literacy instruction, that we are creating or providing some supports to our regions, our districts, and how do we make this happen for teachers? And I can tell you, I'm a principal of elementary school, and so our teachers have 45 minutes of a day for planning. And during that planning time, our focus is on really making sure we design personalized instruction for students. So teachers are administering pre-assessments, they're analyzing their data, they're creating their whole group instruction, they're figuring out how do they differentiate small group instruction for students. So it goes on and on and on with the lesson planning, not to mention the committees they serve on and all of these great things they do each and every day. And professional development is important because building capacity in our teachers, that's going to impact student learning. However, we have to have a great plan, and how are we going to do this? How do we support teachers so that it is manageable and that they can to do this work? So just want us to be really mindful of that, because I know that that's a struggle, and our staff and our teachers are very excited about the great stuff that they're already receiving, because we're in cohort 1 of the letters training. But I know the struggle is trying to find time to be able to do that doesn't infringe on them working all hours of the night to get it done.
Yeah,
so
I so appreciate you lifting that up, and I've been there. I know exactly what you're describing. I mean, if it's not one thing, it's another. There's your own students, there's your parents, there's your assistant principal or principal who's supervising you. Then there's all of your committees, and then there's your family. I mean, it's the hardest job there is. I think it's worth pointing out that in the United States, we spend the least amount of time on than all other developed countries on professional development for our teachers, and we have to come up with another system in order to. I mean, with the structure that we have right now that really doesn't allow for professional development has got to be altered. We have to find a way to do things differently, because and we're seeing this firsthand with letters, because the especially with the first unit of the letters training, the first of 4, is all of the heavy brain research, all the science. it's the most difficult of the four, and it's the first. So, point well taken. Thank you.
Mr. Hall?
Oh, I'll be quick. Thank you, Mr. Chairman. I just want to piggyback on something my good brother, Mr. Keenan down there mentioned. If a child can see it, they can believe it. Here's my point. When we were talking about, it's all of our job. I don't know how many of you have walked by the sign over in the corner. Not in the building, on the corner.
Oh, outside.
As you're walking up here. There's a park over here that's gonna be built, for Afro-Americans, to be distinguished for Afro-Americans. I stopped and looked at the sign that's up there. Now, yesterday, when I was walking up the street. And there's an architectural firm who's on that sign, the Freelon Group.
Yeah.
Okay?
Yeah.
Right there. Less than 10 minutes walking distance. That is a group, there's an architectural firm that is controlled, developed, organized by Afro-Americans. Yes, you see where you jump?
No.
It's right there.
Yeah.
And that's what I'm saying about belief. And I stood there and looked at it, and actually, tears came in my eyes. To see that, but how many other children or anyone else? I saw some kids going out of it yesterday, even know about the Freelon Group. And I think he might have passed.
He did. He died.
Right.
He died.
Yeah, recently. I remember his wife is a singer.
Right.
Yeah.
That's right.
Yeah.
You see my point?
Some of the city council.
Freedom Hall. That's the name of it, Freedom Hall. But anyway, I just want to take about what you were saying, my good friend. We need to be able to, kids need to be able to see it and say, yeah, I can do that. But they don't know anything about it because we don't focus on things like that. And I rest my case.
Thank you, Mr. Hall. That is a great story. All right, we will now take a 10-minute break and return at 10:50. 10:50.
I saw you jump.
We're still live, guys, still live.
This was after the DC. But he also did I never got to meet him. The whole firm is so loud. Until somebody leaves. Okay. So we are back in session, and before we proceed to our committee reports, I'd remind all board members and staff that our November meeting includes our planning and work session. This year, in lieu of meeting off-site, we'll meet in room 150 of the DPI building on November 2nd through the 4th, with our official meeting day being on the 4th, following our closing keynote speaker. This year's planning and work session theme will honor Dr. Robert E. Bridges, an extraordinary educator who passed away in September of this year. Dr. Bridges made numerous contributions to education, was the former chair of the North Carolina Advisory Commission on Raising Achievement and Closing Gaps, which is still relevant and used today. We'll honor his legacy by highlighting bridges to eliminating opportunity gaps, and we look forward to seeing you there. I remind our committee chairs in the audience that all voting on consent and any item requiring action will be done at the end of the agenda via roll call vote. And I'd ask our committee chairs to be as concise and complete as possible. And we'll begin with the Student Learning and Achievement Committee, and this report will be given by the Vice Chair, Dr. Oxendine.
In other words.
Dr. Oxendine.
I am Olivia Oxendine, and I have the honor of being the Vice Chair to the Student Learning and Achievement Committee. And I am actually doing my part as the Vice Chair because I'm standing in for the Chair, Ms. Candace, today. So I will take your orders and try to be brief. This was an extensive report yesterday. I think it totals to be about 11 items. And there is no way that I will do this justice because the information we heard yesterday was thorough and complete and very energizing. So I'm going to just touch over the highlights of what we learned about yesterday. The first item is a new business item, and it is titled At-Home Learning, and the second part of the presentation was the Distinguished Leaders Initiative. The speakers for the At-Home Learning component was Doctors Angie Molinax, Rachel McBroom, Miss Erin Huggins, who is one of the researchers from the Friday Institute, and Dr. Sean Kellogg. So the At-Home Learning Initiative and the Distinguished Leaders Initiative, both are funded out of CARES ESSER dollars. And as Dr. Molinax explained yesterday, this was an opportunity that just kind of fell in her lap. She is the kind of person that has the energy to, pick up a creative idea and go with it, and that's exactly what happened. This initiative has to do with the classroom connections, ensuring that just a large volume of lessons were delivered by way of television as opposed to remote learning. The initiative is divided into two phases. Phase 1 is curated content that was aired on TV. Phase 2 was teacher-generated content and PBS lessons. UNC TV was one of the partners, and UNC TV is now PBS North Carolina. The initiative also has a research component, and that the research component was conducted by the two researchers from the Friday Institute, Dr. Kellogg and Miss Erin Huggins. There is a reporting requirement that's part of the initiative, and the first of that series of reports was presented yesterday to us. Another report will go to UNC TV at a later time. The lessons learned from the initiative, well, let me highlight this. 41 teachers from 22 counties were showcased in the delivery of lessons and also in the development of lessons. A couple of splashes about the initiative. 82,000 families, parents and families, tuned in for Classrooms Connection lessons, and that represents at least one household per broadcast. Over close to 600,000 total views in the Raleigh-Durham market. I mean, that's outstanding for an initiative that was just only a few months in longevity. Some of the improvements that came out of the research study, one had to do with accessibility, making the lessons available in Spanish. Also, in terms of accessibility, to ensure that the lessons are designed so that those with colorblind can access the lessons, and probably closed caption might have been one of the recommendations. Improve the navigation of the lessons and add the lessons to PBS learning media. Modify the program schedule so that students can access the lessons when they are in school. Share information earlier in the year to our stakeholders, mainly our educators. To continue leverage existing partnerships, the PBS nationwide, colleges and schools of education, and state organizations such as the Boys and Girls Club. Extensive partnerships. We have the Friday Institute, the North Carolina State Wolfpack Works, PBS, of course, and our UNC system, and of course our local educators in our districts. So that was the one part of the report. The other part had to do with the distinguished leaders in the remote learning environment, and this was presented by Dr. Shirley Prince. This initiative is divided into 3 tiers. The first tier is synchronous and asynchronous professional development delivered online. The second tier is self-paced directed digital on-demand webinars, and these webinars are facilitated and moderated by experienced users in the online remote world. The third tier is to establish a cohort and cadre model of peer mentors to provide support to other school leaders throughout the year. The partnerships involved in this initiative include NC-PAMPA, the North Carolina Department of Public Instruction, the North Carolina Alliance for School Leadership Development. And I'm just going to take a moment to wrap up this portion of new business by actually lifting a quote out of Dr. Prince's presentation. And it goes this way: "What I learned will last the remainder of my career, and how we approach education for each child. Chances are that virtual remote will be part of education going forward. Even though I wasn't able to complete all of the assignments, I have more tools in my toolkit than I ever imagined." So those are our 2 new business items. I'll move on to action on first read, and the SLA 1 is the Read to Achieve Implementation Guide. The presenters were Amy Ryan, Tanya Parrish, Dr. Christy Day, Ms. Kelly Bingham, and Susan Laney. An outstanding presentation, a very necessary product that has come out of the Office of Early Learning. It is the Read to Achieve Implementation Guide. The staff wants us to approve today sections 5, 6, 8, 9, 10, and 12. Carefully explained in the manual. One of the highlights in the manual that I found most useful is this table. I don't know the exact page, but if you, in the manual itself, it gives you a history in terms of the development of each one of the sections, as well as what is included in each one of the sections. I cannot imagine our districts in North Carolina implementing Read to Achieve without this document. So my hat is off to the group of the section that produced this OEI, the Office of Early Learning, and the other sections within the agency that probably contributed to that endeavor. SLA 2 is the Read to Achieve annual report that is due to the General Assembly. Let me just highlight a few things in the report, or the purpose of the report is to give the number of 3rd graders who are on track, as well as the 3rd graders who are not on track for year-end expectations based on assessments. And these assessments are effective March 13, 2021. And also the number and percentage of 3rd grade students retained pursuant to subsection of the law as a result of reading deficiencies. And I believe this is the one report, Superintendent Truitt, you made note of. We've just got to do better to get our third graders on track where they need to be in terms of growth as well as grade level proficiency. So that is coming to us today for a vote later this morning. SL3, action on first read as well. The presenters were Ms. Sherry Thomas and Dr. Christy Hutchinson. And Dr. Hutchinson is the chair of the Council on Educational Services for Exceptional Children. This is the annual report that is due to the State Board of Education. And I believe this report is it is in statute. A little bit about the council. It is made up of 25 members. 20 of those members are appointees and 5 are ex officio, representing a diverse group of individuals: parents, teachers, higher education, public and private schools, charter schools, and the business sector, as well as the vocational community. The requirement for this council is located in federal regulations under the IDEA. Probably this was enacted during the reauthorization of IDEA in 2004. It also appears, the requirement for having this council also appears in general statutes 115C chapter, 115C 1211. So what we are being asked to vote on today are the recommendations of this council from 2 years, 2019-20 and 2020 and 2020-2021. We received information yesterday on 12 priorities that cover those 2 periods. The work of this council is done in sections, I think 4 subcommittees of the council. Complete a lot of work. I learned so much about this council by preparing this report. Council is very necessary, and it appears as though in 2020-21 a bulk of the work had to do with ensuring that IEPs were met and followed as a result, because of the difficulties around remote learning and going into that very different and kind of a quick turnaround way of teaching our kids, but especially our EC students. So that is coming to us later today for a vote. So moving on to the component of the agenda that contains all the action items. So SLA 4, changes to the 2020-21 student performance data. This was presented by Dr. Howard, and what we heard about yesterday are changes from the first time this report was presented as a discussion item in September. And according to Dr. Howard, 99 schools had data changes, mainly in the area of including the cohort graduation rate. And the cohort graduation rate, 67 schools submitted changes. A total of 99 submitted changes between the board of our state board meeting in September and our meeting yesterday. Overall, the 4-year cohort graduation rate increased by 0.1% to 87.0. The overall 4-year cohort graduation rate increased by the same amount to 88.7. The national rate, according to the cohort graduation rate, according to Dr. Howard, is 89%. Moving on to SLA 5, this is an action item. The Alternative Schools Accountability Model, also presented by Dr. Howard. The alternative schools must submit documentation for one of 3 ways they wish to collect data for the accountability report. This report must be submitted to the agency by August 1. The accountability staff goes into a review process, and they make some decisions about approving the accountability model requested by each of the schools. The 3 options are school improvement grade. Number 2 is data on student and growth and and then they receive a status of either progressing, maintaining, or declining. And the third option is to submit their own model for accountability. The majority of our alternative schools go with the second option. So this is coming to us today also for a vote. We had one discussion item, SLA 6, presented by Trey Michaels, Director of CTE, and he presented the 2022 Career Technical Education Course Inventory and Essential Standards Review. The CTE curriculum must be reviewed every 5 years. I would imagine it's very extensive work. On a 5-year cycle following an approved process for reviewing the curriculum. The changes fall into several strands. The changes could be the result of changes in industry and technology. The changes could be a result of gaps in offerings, or the changes could be the result of something as minor as coding and course description changes. Two pilots are going to begin right away. One has to do with hospitality and tourism, management 1 and 2, and solar photovoltaics, which is solar panels, I understand. We heard about that earlier, 1 and 2. So this item is a discussion item. It will come back next month for a vote by this board. Several consent items, SLA 7, the high school diploma endorsement, SLA 8, the 5th grade career awareness program, SLA 9, career and college ready graduation programs. Each of these reports must go to the Joint Education Legislative Oversight Committee. SLA 10, the General Assembly 4-year cohort graduation rate. SA 11, General Assembly students with disabilities and definition of residence. So those are the 11 items coming out of SLA.
Thank you, Dr. Oxendine. I now recognize Mr. Hall, Chair of the Government and Community Affairs Committee, for that report.
Thank you, Mr. Chairman. I will be brief. Yesterday, of course, we heard from the Director of the Government Affairs, Mr. McKinney. He also highlighted, of course, the event that went on in Royal Rapids last weekend and celebrating that 100th year of education in a building that was built in 1921. And went on to talk about his visits out west, up in Buncombe County, and along with the state superintendent and visiting schools. We all know the role that this committee will take, because the board chair outlined clearly yesterday the role of this committee, and we will certainly move to fulfill that goal and that inspiration that you put, that you charged us with yesterday, Mr. Chairman. So at this time, I'm going to ask Jamie Falkenberry and Mr. Freeburg McKinney from the Office of Government and Community Affairs to come forth and talk a little with us about House Bill 695. I know our superintendents want to hear, our principals want to hear about that.
Not yet.
And various other education changes. And do concise your.
Oh, this will be quick.
Okay.
Thank you. I just want to thank everybody for giving us the opportunity to present. A lot of times in the legislative process, you have a design that you want to follow, and legislative process, bills become other bills, amendments get thrown on your bills, and throughout this legislative process, there were really 4 provisions that were not controversial with EPPs, Treasurer's Office, DIT, DPI, State Board, and after talking with the House and Senate, and I really want to thank, Freeburg and I really want to thank Representative Elmore, Representative Torbett, Senator Ballard, and Senator Lee for helping us package a bill through the legislative process that could make it through quickly without other amendments and getting sort of hijacked with other provisions. So with the 695 that passed the House last week unanimously and the Senate this week unanimously really make some changes to give some relief to our licensure department, to our school nutrition program, to our IT department here at the department, as well as to Alexis Schaus's team on several items that we've been really working on. And I just want to thank the General Assembly for moving this to the governor's desk, and hopefully we can get it signed soon. Is there anything I missed?
I remember you got a breath as you
Any questions? I was on a phone call and then I heard that Dr. Oxendine wrapped up, and I was like, oh, I gotta go. No, but we're good, and I really want to thank the State Board and Freebird and Ann Murtha and Carson on DPI side for all the work that we did to usher this through the legislative process.
And we thank you.
No, thank you very
for your
much.
attention and your hard work. Ms. McKinney, is that anything?
Yes, sir, that's it.
My fellow board members, do you have any comments or questions for this esteemed group here? Hearing none, thank you, sir.
Thank you, Mr. Hall. Thank you, Mr. Falkenberry.
Thank you very much.
Appreciate it. I now recognize Ms. White, Chair of the Education, Innovation, and Charter Schools Committee for that report. Ms. White.
Thank you, Chair Davis. I'm Amy White, and Jill Kamnitz and I have the privilege of working on the Education, Innovation, and Charter School Committee. Yesterday, I need to offer an apology. I got so excited about my little turbulence metaphor that I did not do as good a job teeing up this conversation as I probably could have, so I am glad that I have a second chance to do that. So the new business item was the charter school funding update, and I wanted to explain to you why we brought that to you yesterday. So charter leaders in the past month and since school started have reported that they had fewer students show up for class than what they projected and what they were projected to be enrolled. The current allotment policy requires that charter schools are funded based on the current year month 1 average daily membership, ADM. And so when turbulence occurred and the students that were projected didn't come to school the first day, one of the reasons proposed for that was the students didn't have the virtual option. Then Senate Bill, or SB 654 was passed, which allowed charters to offer that virtual option. And so thus the turbulence could have occurred with students not being there originally and then returning to school, or students leaving the school. But there was this idea that perhaps the first ADM was not an accurate student count. We know that when there's not an average, that it can significantly impact the budget for that charter school. So charter school advocates came to us and suggested that perhaps it would be a good idea to take the best of 2 ADM counts, either days 1 through 20 or days 21 through 40. And so they were looking for a fix for this year. And so we asked the amazing Alexis Schaus to sort of walk us through what that would look like. When she brought that to us, it revealed the idea that perhaps we really need to look at a long-term option about how charter schools are funded. So yesterday, in the presentation, she talked about current policy and procedure. She talked about the consideration of funding based on month 2 ADM as opposed to month 1 ADM, and she talked about the impact on both the charter schools and LEAs. At the end of the discussion yesterday, there was consensus around the table that we asked staff and Ms. Schaus to start working on a plan to address the long-term issue. But we're still looking at what the fix might be for this short-term issue for charters for this year for funding as a result of that turbulence. One of the possible fixes could be to use contingency funding, or to look at ESSER 1 funds if there were any to be left unallocated that might help those charter schools bridge the gap for this year. So in conclusion, 2 issues before us. One is the short-term issue related to student enrollment and the turbulence in student enrollment for the 2021-22 school year. Then the second issue is a long-term issue, an issue facing the board and really the legislature in how charters are funded and how ADM impacts the overall school budget. So I hope that that gives clarity, and if I misled you yesterday, it was a great object lesson, but that's the crux of the issue. There was a discussion item yesterday provided by Mr. Jay Whalen on the NC Access timeline application and rubric. As you know, the NC Access grant is a federal grant that allows charter schools with an opportunity to provide amazing educational access to charter schools for our economically disadvantaged, educationally disadvantaged population. Number of different tools are used with that grant, transportation, additional lunches. We've seen data presented through the report last month that our schools are gaining traction in how they're using that funding, but it's time for that timeline and application and rubric to be approved for this year, so it's before you this month for the discussion. It'll be before you next month for action. Mr. Whalen did let us know that we don't know if funding has approved for another cycle. He'll have that information in November that will let us know whether we'll have access to new funding or whether we'll be allocating what's remaining in the initial $36.5 million for this year. There were two consent items, EICS 2 and EICS 3. EICS 2 was Metroliner Regional Scholar Academy's weighted lottery request. So that's the request that we hear frequently from schools when they'd like to use a lottery to help better balance their student populations. And then EICS 3 was our report to the General Assembly on low-performing districts and schools. And you heard last month that because of COVID and the lack of data, that it was much of the same information presented with a few tweaks here and there. Mr. Chair, that concludes the report on the business that we did yesterday.
Thank you, Ms. White. I now recognize Mr. Reginald Keenan, Chair of the Healthy Responsible Students Committee. Mr. Keenan.
Thank you, Mr. Chair. Of course, Reginald Keenan, and with my good friends, I always say, Mr. Alan Duncan, we chaired this together, the HRS committee. On new business, we had a presentation by Ms. Heidi Austin and also Dr. Mass Hoskins. And what we talked about yesterday was North Carolina Project Activate pilot program expansion. And basically, it was to update us as to what's going on with the Project Activate. The DPI, North Carolina Department of Human Health and Human Services, was awarded a second concurrent 5-year, $8.9 million grant to scale work currently underway. Project Activate is North Carolina's implementation of SAMHSA's Project Aware. North Carolina Project Activate implements the evidence-based school mental health supports and services through a full school and community continuum. And of course, it's another way to address the needs of the whole child. We were fortunate enough to have 3 county public school units that were, they were Jackson County, Nash County, and Sampson County, was awarded $8.9 million. The good thing about that, when you put cohort 1 and cohort 2 together, we have approximately 124 schools will be effective when this is all over, and almost 60,000 children would benefit from that. If we ever need it, we need it now. And briefly, some of the goals of the Project Aware is, number 1 is increase the knowledge and the effective practice of all school staff in recognizing and responding to student mental health needs, reduce school dropout, reduce the rate of attempted suicide and substance use, improve coordination and sustainability of mental health supports. And that was more, but I just want to give a quick rundown of some of the goals that would be obtained. Mr. Chair, on the second item we had action on first read. Ms. Allison Schaefer, our attorney, of course, she brought before us a request to provide a temporary extension to allow students to try out interscholastic athletics at the middle and junior high school level only, due to delays in physical position availability to complete the physicals due to COVID-19, and only for 30 days, and I think the date will be November 15, 2021. And that again is action on first reading. And lastly, of course, discussion item is we had to, based on Senate Bill 693, which was, of course, enacted on September 1st, 2021, requires the State Board of Education in consultation with the superintendent of public instruction shall adopt a rule requiring information on child abuse and neglect, including age-appropriate information on sexual abuse, to be provided by public school units to students in grades 6 through 12. And of course, that's been done and it's been on in our report, so that has been implemented. And that's all, Mr. Chair.
Thank you, Mr. Keenan. And now recognize Dr. Oxendine, Chair of the Educator Standards and Practice Committee.
Yes, I am Olivia Oxendine, and I chair this committee, and joining me in that responsibility is Ms. Amy White. Under action, ESMP 1, policy amendment that pertains to LICN 003, we are coming before the board for final approval of adding Reading Foundations Assessment 190 with a cut score of 233 as an option for teacher education candidates in our UNC system and our private schools to take for licensure purposes. And this test applies to elementary education as well as general curriculum special education. The next item is a discussion item, ESMP 2. This is the monitoring of the Educator Preparation Program's annual report, and Dr. Seiberg presented that item for us. The test really, or the report, the staff here in the agency really looks for anomalies and statistics, and as well as satisfaction information from our school districts. And also, EBOS data is a part of the official report, and also educator effectiveness data is also part of the report. Because EBOS data is not available at this time, the report that is going to go over to the General Assembly will contain information related to the educator evaluation data, as well as the report of anomalies. There are no anomalies. And also included in the report will be data from our school districts, teachers, principals, superintendents, in terms of satisfaction of the candidates that are employed in their districts. The one item that is the consent item is the Pepsi annual report that was prepared and presented last month by Dr. Kim Evans. And that report just really gives an overview of the activities of Pepsi during the past year, and also a very detailed calendar of meetings. So that concludes my report. Thank you, Chair Davis.
Thank you, Dr. Oxendine. I now recognize Vice Chair Duncan, Chair of the Business Operations Committee.
Thank you, Chair Davis. Along with Todd Chastain, we lead the Business Operations Committee. And this, during our committee meeting, we covered a number of items. First one was a report that was asked for by the board. The board has increasingly and wisely asked for reports on programs that we have received or grants that we've received to see what results we are obtaining. And this is one of the requests the board has asked for. And it's the intent of the committee to continue with all the grants and other things we've had recently with the ESSER funding, to continue to come back and report to the board on the results of the work that's being done. This particular report was focused on the school improvement grants and the innovative partnership grants, which is on a 5-year cycle that ends next year. So we're nearing the end of it, and all the grants are turning more to innovative partnership grants for the remaining grants that will be awarded, which are near the end. So primarily, this is a look-back report in terms of what got accomplished, particularly with the school improvement grants. I think we were honored, and I think we all felt honored to have Dr. Patrice Faison, Dr. Michael Fuga, and Dr. Edie Morris Bryant here to provide a report about specific things they worked on and were able to do in schools as a result of their school's involvement with the school improvement grants. It was a very uplifting report in terms of really positive things that happened for kids. If you look at the study, most of the schools that were involved with the SIG grants showed either meeting expectations and or exceeding expectations. There was a small number that did not, of course, and those we need to learn from that. The lessons there are as valuable as the lessons on what's being done right. But there was a lot that was obviously done right, and the lessons of things that went well were shared yesterday, and I think all of us really appreciated the dialogue that we had and the information that we received. and intend to continue to coordinate with these outstanding educational leaders as they bring thoughts and ideas to us that we can share across the state with all of our schools to try to get the best possible results for our students. BizOp doesn't get to talk about these exciting things very often, so we really enjoyed this opportunity. And it was well worthwhile, and I think everybody got a lot out of that presentation. Our second item was BizOp 2, which was brought to us by Dr. Tricia Townsend. And I should mention Dr. Townsend and Ms. Tanisha Madry brought us this report. In terms of the report, it's very nice to hear from Ms. Madry from the first time. She's one of our 2 school improvement program administrators. Our other, Mr. James Pop, was unable to be here because he did his civic duty as a juror. And as a lawyer, trial lawyer no less, I want to thank him for that, because he did the right thing, and we appreciate him being there. We look forward to having him make a presentation sometime soon. BizOp 1, our first action item, was a report on ESSER 2 funding for Ellis grants. Dr. Townsend did an excellent job, as she always does, reviewing how the grant was assessed, how it was graded, how it was analyzed, the fact that there's an emphasis in trying to make sure all parts of the state benefit from these grants, and what the scoring rubric was, and then how the ultimate successful grantees were selected. And so all that information was provided to the board. This is a total of $15 million from the Federal Coronavirus Response Relief Fund, or ESSER 2, and that was part of the 10% holdback of ESSER 2 for the SEAs. This particular amount was designated by the legislature for the SEA to distribute in this manner, that is through these Ellis grants. So that was our second item, or excuse me, our first action item for us to consider as we vote later today, was to approve those grants. Our second item was one of those items that we really appreciate Ms. Schaus for, because it was taking together all the minor or major statutory changes, and they were mostly minor, that relate to school attendance and student accounting manual, and allowing us to modify our policy with the amendment to modify and allow for the modification in these manuals. So she took a complex topic that had 100+ pages of materials and gave us a very concise report in terms of what has been updated, and something that we need to do, and we appreciate very much the support we get for that. Our BizOp 3 item came from Dr. Mark Sandberg, and this is the collaborative purchasing report, and the board is being asked to receive this report, which will then go to the legislature. The legislature passed an act a few years ago, the collaborative purchasing report, so that the various agencies got together thinking of the greater purchasing power will be a good thing. And then also wanted to get a report on from each agency, not just us, in terms of what's happened in terms of collaborative purchasing. And one of the things I think ideally we'd all like to see, this was passed so that we can be more efficient in purchasing and save money. I think Dr. Sandberg effectively explained why it's had a little difficulty in getting metrics set for being able to show definitively where savings were made. He did illustrate as part of the report where savings occurred from having less administrative, less overhead expenses, those kinds of things were definitely limited. And then he's also shared some ideas as how to get a better handle on perhaps showing where other savings are occurring. So there's a comfort level that there are savings occurring. It is just, I think it was important for Dr. Sandberg to be able to explain the struggle in showing all of the savings that are potentially there. And so that report is ready. We're being asked to receive it so it can then be distributed to the General Assembly, consistent with their request. BizOp 4 was an action item which has been deferred to any meeting we may hold in October, and certainly by no later than our November meeting. Given that the budget may come out in October, the thought is we may be having more than one meeting before November, or at least one meeting, before November. On updates and contracts, we got our executed contracts report and our planned contracts report, and there were no questions about those. Uniquely, this is the first month in a long time we had no contracts over $500,000 for board approval, so that was something we did not deal with. Ron Paxton gave gave us a very good agency vacancy report again. He does it in less than 2 minutes, focuses on the charts that he's developed, and focuses on subjects that are of concern to the board. This month he focused on providing us with charts and a more micro view of those positions that have been open for more than 365 days. Some of them are being filled, some are in interviews, some have been reclassified. So there was explanations, and the number is down from what was there. And so I think it was very helpful because this board has shown a real interest in making sure we are fully staffed, knowing the needs of the department. And so appreciate the work of Mr. Paxton and his department, and that report again was helpful in showing specifics in certain areas. Finally, Alexis Schaus gave us an excellent report on the overall spending for our ESSER 1 through 3 programs, as well as GEAR and other COVID programs. So it is a bit overwhelming if we don't always stop and pause. As we go through BizOp, we try to be very careful to point out these funds are from ESSER 1, or from ESSER 2, or from ESSER 3, or from GEAR, because the board has had to deal with all of these funds in different fund sources, and they have different timelines, and they end at different times. So Ms. Schaus put together a thorough report in terms of where the spending is from the different programs, what's been spent and not spent. Not surprisingly, ESSER 3 funds, for example, not many have been expended yet. That's because they don't expire till September 30th of 2024, and ESSER 1 and 2 funds would be ones you would want to be expended first primarily. And so it was a very good presentation in terms of letting us know where we are in terms of expended and unexpended funds, where the timelines are for each of these funds, and I think kept the board well apprised of where things are, and we're going to need to stay that way. It's going to be necessary to be pretty alert with respect to these things. It's sort of part one. We're watching very carefully the funding as it goes out or before it goes out, and part two is we want to, as a report we got at the start of our meeting, be able to monitor and hear the reports about what's being done with the funds. And so there's going to be a lot of compliance and monitoring going on within the department. We're thankful to the people that are doing it. It's an extremely difficult workload for people in the department. As you saw, for example, we're charged with accounting for funds that went to other agencies as part of this. So just to think about the challenges of that you're responsible for accounting that. All of the LEAs and PSUs around the state that got funds, our department ultimately is responsible for being able to account for those and to work with any federal auditing of these amounts, and there will be auditing of these amounts. So the challenge is huge, and I think it is important for the board to stay focused on that. And with that, we're finished.
Thank you, Vice Chair Duncan. And colleagues, this concludes our committee reports for the day. We do have one update on the North Carolina Education Corps for the board's awareness, and I'll ask Dr. Townsend Smith to provide that item.
Good morning, board members. I will be brief. Some time ago, you approved the use of the NC Education Fund for NC Education Corps purposes. Remember, we have exhausted the funding that was currently in the account for NC Education Corps purposes, and their hope was to get over the finish line with pursuing the 501c3 status. There's been a holdup at the federal level with the processing of that material, and so on September 23rd, they requested to continue the use of the NC Education Fund to accept funds on behalf of NC Education Corps, and when those funds come in, we will just be the pass-through for those funds. Questions, concerns about anything?
Yes, just to add, since the board is the custodian, fiduciary responsible body for that fund, we wanted to make sure that it was apparent to every board member and the public of our continued support of the Education Corps in this temporary phase. Any questions? Great, thank you. Okay, board members, are there any other items of new business? Hearing none?
Mr. Chairman?
Treasurer?
Hey, how are you?
Great. What do you have for us today?
Just very briefly, good news from the world. I just wanted to call attention to the fact that we are kicking off and celebrating National Disability Employment Awareness Month. And the way this connects back to the State Board of Education is that we all know that we have an employment crisis in North Carolina where we have the inability for businesses to, including governments as a business, to operate because of not being able to find essential workers. And the developmental employment awareness for people with disabilities is highly important because we've gone across the state and we have many instances of partnerships with the ARC of North Carolina that's connecting employees with employers, some of whom have developmental disabilities. And the reason I wanted to call it to the board's attention is that we do this also in conjunction with a program that I've never spoke to this board about, which is called ABLE. We run the ABLE program, which stands for Achieving a Better Life Experience. Everybody in that room is familiar with 529 plans. I never want to say that anyone shouldn't or can't go to college, but the ABLE accounts are set up, certified by the Internal Revenue Service, so that people with developmental disabilities can have money be put in their name without it impacting their Social Security disability payments, not only to meet current life expenses, but maybe future life expenses when their caregiver's no longer here. So it's just a nice way of me ticking and tying with this board some of the great work that's going on across North Carolina. I was at AB Tech recently with Project Search and met a couple of individuals, one who works at Old Navy, another one who works at a hotel, which was kind of interesting to me because the Thursday before that, I was at a major hotel chain in Charlotte, North Carolina, at the Charlotte airport, and myself and 7 other people stood in the lobby for 1 hour, and there were no employees on premises. No employees in any way, shape, or form. So being able to give the joy of achievement and employment power to people with developmental disabilities is very important. And also this is National Retirement Awareness Focus again this month in October. And we have so many folks in that room, as well as across the school system, that are obviously connected to the pension plan. But this is more focused on our defined contribution plan, which is our 401 and 457, which has about $15 billion in it. So just want to draw some positive attention to National Disabilities Employment Awareness Month, as well as Retirement Readiness Month, as it relates to these items that come across our responsibilities here at the Treasurer's Office. And Ms. Chairman, thank you for your time, and it was great to see many of you yesterday.
Thank you, Treasurer, for that report, and even more, thank you for your stewardship of so many funds that our public school educators rely upon and our citizens as a whole. So thank you so much.
Thank you.
Board members will now vote on any item requiring action from your committee reports. A thorough discussion and report was provided on each item, including any respective consent items. A reminder that any item on the consent agenda is primarily not complex, and this may have come before the board for discussion in the prior month. I note also that the board members have seen these consent agenda items for at least a week. So at this time, I ask if there's a request to remove any item from the consent, action, or action on first reading agendas. Hearing none, I request a motion to approve the following: the September 1st and 2nd, 2021 meeting minutes, SLA 1 through 5 and 7 through 11, EICS 2 and 3, HRS 1, BizOp 1 through 3, ES&P 1 and 3, the IPL and ILT licensure recommendations, and the residential hires and ISD hire recommendations brought forth by our superintendent, and the adoption of the Strong Schools Toolkit as presented today. Is there a motion to that effect? Motion by Mr. Hall. Is there a second? Second by Mr. Keenan. Any discussion on this motion? Hearing none, Dr. Townsend Smith, will you call the roll to capture the vote?
Yes, sir. Dr. Oxendine?
Yes.
Mr. Keenan?
Yes.
Mr. Hall,
Yes.
Dr. Tipton Rogers,
Yes.
Ms. White,
Yes.
Mr. Ford,
Yes.
Treasurer Falwell,
Yes. Yes.
Vice Chair Duncan,
Yes.
Chair Davis.
Yes. Motion carries. Thank you all that contributed to a successful meeting this month and the good work on behalf of our public school students. We look forward to learning together at our November planning and work session. This concludes this month's meeting. At this time, I request a motion to adjourn.
So moved.
Motion by Dr. Oxendine, second by Mr. Hall. Dr. Townsend Smith.
Yes, sir. Dr. Oxendine,
Yes.
Mr. Keenan,
Yes.
Mr. Hall,
Yes.
Dr. Tipton Rogers,
Yes.
Ms. White,
Yes.
Mr. Ford,
Yes.
Treasurer Falwell,
Yes. Yes.
Vice Chair Duncan,
Yes.
Chair Davis.
Yes. We are adjourned.
Absolutely.